millions to monitor animal diseases and prevent future pandemics. Australia will aim to be a world leader in monitoring animal diseases, pouring millions into increasing its early warning capabilities to prevent future pandemics. The federal government will invest $8.4 million over the next 4 years to monitor emerging diseases in both wildlife and domestic animals, including those with pandemic potential. There are an estimated 1.7 million undiscovered viruses in mammal and bird hosts, which could evolve into different variants that pose an unknown level of risk to humans. Agriculture Minister David Littleproud said the government was taking a true One Health approach that recognized the interdependencies of human, animal and environmental health to prevent future pandemics. To stay up to date with latest top stories, make sure to subscribe to this YouTube channel by clicking the button above this video. COVID-19 has brought into sharp focus the importance of recognizing and managing emerging zoonotic disease risks which can originate from wildlife, Mr. Littleproud said. This program positions Australia as a world leader of the global transformational change agenda aimed at preventing future disease risks emerging from the human-animal environmental interface. The government has partnered with Wildlife Health Australia, WA, which will lead delivery of the program, using its extensive networks across the country to investigate and analyze wildlife disease events. Nearly all major exotic livestock diseases of potential concern to Australia, including African swine fever and foot and mouth disease, will have wildlife or feral animals as part of their cause or spread. WA will be bolstered with more funding for thorough field, laboratory and epidemiological investigation into selected wildlife disease events. WA Chief Executive Rupert Wood said the new program would allow the organization to identify the underlying causes of wildlife health events. That will both improve the outcomes for our wildlife as well as providing the information we need to more thoroughly analyze the potential One Health implications of such events, Dr. Wood said. The program will also seek to establish WA as an official world organization for animal health collaborating center on wildlife health for Australia and the Indo-Pacific. Australia is already helping its Pacific neighbours fight African swine fever, providing Timor-Leste and Papua New Guinea with more than $400,000 to mitigate future outbreaks. AFS hit Timor-Leste in September 2019 and the outbreak, along with severe flooding, has caused the death of more than 100,000 pigs, or close to a quarter of its total population. Around 72% of households in Timor-Leste keep pigs, while about 600,000 households in the PNG Highlands rear nearly 1.8 million pigs, producing some 27,000 tons of pig meat annually.